السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم إن الحمد لله نحمده ونستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلل فلا هادي له أشهد أن لا إله إلا الله وحده لا شريك له أشهد أن محمدا عبده ورسوله سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي Assalamu alaikum warahmatullahi ta'ala wa barakatuh. Am I audible? So inshallah we'll just spend some minutes to talk about infertility, the orthodox and therapeutic remedies. I'll be going through that, this outline. We'll do an introduction, we'll talk about an overview of infertility and what our treatment options are. And then we'll look a little bit on the Islamic law concerning fertility treatment. And we'll also talk about facts, myths, and misconceptions about IVF. And then how do women cope with infertility and the way forward, inshallah. I'll start with the verse of the Quran. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Lillahi mulku samawati wal ard. Yakhluqu ma yasha'u wa yahabu liman yasha'u inathan wa yahabu liman yasha'u dhukur. أو يزوجهم ذكرانا وإناثا أو يجعل من يشاء أقيما إنه عليم قدير. Talking about the overview of infertility now. This thing will move. Infertility is defined as the inability to have to achieve conception. No, it was not. Infertility is defined as the inability for a couple to achieve conception after 12 months of unprotected regular vaginal sexual intercourse. And there are about 186 million couples in the developing countries alone that are affected by infertility. Most of the infertility in the developing countries is caused by infection. Many of us know about PID. Any infection in the reproductive tract is the one that causes a majority of the infertility in our own side of the world. We have gonorrhea, chlamydia infections, and so on. On the average, about 15% of couples would have infertility. And what are the contributory factors? For the females, about half of it is due to the females, another half is due to the males. Previously, it was thought that it's only the females that contribute to infertility, but studies recently have shown that the amount contributed by male is equal to that contributed by female. So you cannot really point your finger at the woman that she's the cause of infertility. Up to 35 to 40%, for the male, 35 to 45%. Then both of them, when you look at factors in the man and the woman together, you can have factors up to 30%. And then there are some that nobody can explain why these people have infertility. For the female now, what are the causes? Tubal problem, as we mentioned, anybody that has the repeated infection, PID, it can affect the tubes. And those infections can be PID, it can be sexually transmitted, other sexually transmitted infection. It may be that the woman has had a miscarriage and she did not treat it very well, and there's infection that goes up into her womb. And then sometimes after delivery, if the delivery is not also well taken care of, it can also cause infection that can damage the reproductive tract of the woman. Sometimes it's because the woman is not ovulating. The commonest cause is what we call PCOS, polycystic ovarian syndrome. And this is a situation where many women do not ovulate. They have long menstrual cycles. They'll spend like 2-3 months without menstruating. That means they are not actually ovulating. Then you have hyperprolactinemia. Many of us have done hormone tests and they will tell you that your prolactin is high. That alone can stop ovulation and also cause infertility. Then you have premature ovarian failure, where so many women, their ovaries stop functioning before the age of 40 years. Sometimes it may be that congenitally, that is the way the person has been created. He doesn't have tube, the person does not have ovaries and does not have the womb. Medical conditions, the condition itself as well as the treatment of those conditions can actually lead to infertility. Hypertension is there, diabetes, endometriosis, fibroids, thyroid disease, all these ones. The disease themselves as well as the treatments for the disease also cause infertility. Sometimes some people undergo chemotherapy, radiation, you go for x-rays and some radiation therapy. That can damage the growing follicles in the womb, in the ovaries, as well as for the male too, the testicles. Then if you have cancer and you are taking chemotherapy, that's the one that you put through the veins to kill cancer cells. That can also affect the ovary or the testes. Then the lifestyle, smoking, alcohol, substance abuse. It's very unfortunate that we have a lot of substance abuse now, even among Muslim women in the north. So that can also contribute to infertility. Sometimes we cannot even explain the reason why. For the men, same thing, sexually transmitted infections, the gonorrhea. Many of them have had it maybe in their university days or something. Then you have childhood mumps. It's also an infection. Then sometimes in the genital tract of the male too, you can have what we call varicocele that causes blockage in the pathway that the sperm passes. That can also lead to infertility. Then medical conditions also applies to the male: hypertension, diabetes, sickle cell, and then sterility from any other cause. Radiation again can also affect the males, as well as chemotherapy. Wearing very tight, non-cutting underwear is very common. It can also affect fertility in the males because the testis is outside the body, because it needs about 1 degree centigrade less to be cooler than the inner body temperature. That's why it's outside. So anything that makes it to be under heat also affects fertility. Smoking, alcohol, and other substance abuse also affects males too in terms of fertility. And then you have those that are unexplained. What about the impact of infertility in Africa? In Africa, we have so much priority. We give so much priority to childbearing. And it has a very pivotal role in the survival and flourishing of any marriage, and also the lineage of individuals. So children are said to be a form of social security, a source of economic survival. And if you don't have a child within your husband's home, it looks as if you are still sitting with one leg. You have not really sat down well in that marriage. And what are the effects of this if a woman does not have a child within a marriage? There's social stigma. You cannot even enter into groups, communities. People will be pointing their fingers at you that you are not, you don't have a child. There's prolonged periods of sadness, depression, mental health. Mental health of so many sisters and brothers are affected by infertility. Some people consider suicide. There's marital and sexual problems because people don't usually have sexual intercourse for pleasure. They now look at it as if, I'm ovulating now. We need to meet, And there's a lot of stress associated with that. Medical expenditure. For IVF, which we'll see just shortly, if you go to the level of going for IVF, it costs a lot of money. For now, it costs between 2 million to 2.5. Some people sell their assets to be able to access that treatment, and at the end of the day, they become bankrupt, and they lose all those assets, and IVF is not 100%. It can lead to separation because some people believe, okay, you're not having a child, let me try somewhere else, either legally or illegally. The man may say, let him try another lady. The woman will say, let her try another man. And sometimes it can lead to divorce. Then there's loss of inheritance. For the woman and also for the man, if he does not produce a heir, some of them have a family lineage that inheritance passes through the lines. And they'll say that you don't have a heir, so you cannot inherit certain things in the family. And then polygamy, of course. Definitely, if a woman is not having children, it is a reason why polygamy takes place. What are the treatment options? We have the option of conservative management, that's staying and waiting. Studies have also shown that 80% of women that get married within 1 year will conceive. Then about 90% after 2 years, they will conceive. So that's why sometimes if you actually start counting, a woman gets married and you are the ones that, among the people that count 9 months for her, she's actually pregnant and she'll deliver within that 9 months. But sometimes it takes 2 years for them to get that pregnancy. So for most couples, 7 to 8 of them out of 10 will get pregnant within that 1 year. And then by the end of the second year, 9 out of 10 will get pregnant, especially if the woman is younger. And then you also have the other option of ovulation induction and timed intercourse. Ovulation induction, many of us have heard about Clomid, letrozole. Those are the things we use for ovulation induction. Normally, it's only 1 egg that comes out of the ovary of a woman every month. But by the time you give Clomid or letrozole, more eggs will come out. So you are trying to improve the chances of the woman getting pregnant. And then you tell them they should meet at a particular time during the ovulation period, hoping that she can get pregnant. Sometimes that does not work, and you use what we call intrauterine insemination. We'll look at it briefly after the next slide. The sperm of the husband is prepared, and you try to remove all the other semen, all the debris, and you prepare the clean and neat sperm and concentrate the good ones. And you put it into a catheter, and during the ovulation period of the woman, you put it into the womb, hoping that it will bypass the cervix, and then the woman will be able to get pregnant. Then the last on the line is in vitro fertilization. where you have the woman is giving some drugs to produce a lot of eggs, but this time around, you bring the eggs out of the human body, mix it with the sperm of the husband, and look at fertilization. You actually visualize that you have fertilization taking place before that embryo is taken back into the uterus. So for natural conception, the sperm travels through the vagina, through the cervix to the uterus and to the fallopian tubes. Within 90 seconds of sexual intercourse, the sperm reaches the cervix, and within 5 minutes, it is in the other end of the fallopian tube. So that is why whenever a person is raped, they will tell you that you should rule out pregnancy, because within 5 minutes, that sperm has already reached where the egg can be. If the sperm arrives at the tube after ovulation, the sperm and the egg can meet, and fertilization takes place within the tube. And after the fertilization takes place within the tube, it now comes back into the womb to implant, and that is where the baby will actually grow. The cervix naturally limits the number of sperm that enters the uterus, and because it's closed, but during the time of ovulation, it's a bit slightly opened, and it's a bit softer. And this means there's only a small percentage of sperm that will actually reach the fallopian tube at the end of the day. So this is what we're talking about, intrauterine insemination. It's a procedure that you now have washed sperm. Sometimes the sperm has a lot of debris, a lot of other factors, cells that are stopping them from moving. So you clean the sperm, so to say, and then get the good ones that are active and are motile. That's the one we inject into the uterus during the time of ovulation, hoping that it will increase the chances of the woman getting pregnant. So assisted reproductive technology, IVF, as we all know. When we talk about in vitro means you are handling it outside the body. In vivo means inside the body. So in vitro, as I explained previously, you give the woman a lot of hormones such that she produce more eggs, and then under anesthesia, you remove those eggs. At that time of removal of the eggs, that is when you expect the husband to produce sperm. We put the sperm and the eggs together. It's not usually a test tube. It's actually a petri dish that you put this egg and wait for fertilization. No manipulation is done. That fertilization that was supposed to take place within the body now takes place you look at it and confirm that fertilization has taken place within 18 to 24 hours. And then you allow the embryo now to grow. Because those that show potential for life and growth are the ones that you transfer. Not all the fertilized egg will survive 5 days. So you wait up to 5 days. Those that show the potential that they have life and they are ready to grow are the ones that are put back into the uterus. It is expensive. It's an expensive procedure. It's a very important technology. It's expensive and it actually works. And there's an inherent risk of failure because the take-home baby rate at the end of everything, that means 2 out of every 10, 2 to 3 people out of every 10 women that undergo IVF will be the ones that will actually deliver babies at the end of the day. What about the brief history about IVF? It started a very long time ago, several centuries ago, but the one that actually led to a live human being was in 1978, and it was done by Steptoe and Edward. You'll see their pictures shortly. In Nigeria, we have Giwa Osage and Ashiru. They were the ones that started in Lagos in 1989. And here in Abuja, we have Baby Hanatu by Dr. Wada, Nisa Premier Hospital, 1998. And today, in Nigeria alone, we have more than 80 centers, and we have at least more than 8 million babies born worldwide by IVF. So these are the first people that did IVF, Steptoe and Edwards. One was a gynecologist, the other was a physiologist, and they were the ones. And that's the baby there. Louise Brown, that's the first IVF baby. She's a mother now, she's about 44 years old. She's a mother of 2 children. She's as normal as everybody. This is Baby Hanatu, the one of Nigeria in Abuja. She was born in 1998. She's a medical doctor now. So IVF babies are very normal. So IVF, it's a 5-step procedure. As I explained, you have the stimulation part where the woman is given a lot of injections to take. Then the time of removal of the egg. Then we mix the egg and the sperm together in a petri dish for it to fertilize. And then embryo culture, waiting for about 5 days to see those that have the potential for growth and survival. And then they embryo transfer back into the uterus. And within 2 weeks, you have the pregnancy test to know whether the woman is pregnant or not. So what is the Islamic law on fertility treatment? In Surah Al-Baqarah, Allah subhanahu wa ta'ala said, وَلَنَبْلُوَنَّكُمْ شَيْءٍ مِنَ الْخَوْفِ وَالْجُوءِ وَالنَّقْصِ مِنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. and we will most certainly try you with somewhat of fear, hunger, loss of property, lives and fruits, and give good news to those that are patient. الَّذِينَ إِذَا أَصَابَتْهُمُ الْمُصِيبَةُ قَالُوا إِنَّا لِلَّهِ وَإِنَّا إِلَيْهِ رَاجِعُونَ. Who, when misfortune befalls them, they say, surely we are Allah's, and to him we shall surely return. In Surah Shura, the verse that I read at the beginning of my presentation, Allah's kingdom belongs to the heavens and the earth, and he creates what he pleases. He grants to whom he pleases daughters, and grants to whom he pleases sons, or he makes them of both sorts, that's male and female, and makes whom he pleases barren. Surely he is knowing, the powerful. This is a verdict. There is a verdict of the Islamic Fiqh Council of the Organization of Islamic Conference, which came out with a fatwa, because so many people believe that IVF may be wrong, it is haram and all that. But there's actually a fatwa from the Fiqh Council that talks about the Majallat Al-Majma' number 3, volume 1, page 423. It talks about there is nothing wrong with resorting to assisted conception in case of need. And it is absolutely essential to make all the necessary precautions. So as much as possible, try to get a female gynecologist. Do not expose yourself unduly. And make sure it's only the sperm of the husband and the wives that are married that is used, and so on. So all those rules have been clearly stated. And the wife's egg, using donor sperms, donor eggs, donor embryos are not allowed in Islam. And surrogacy is also not allowed, because in Islam, the person that gives birth to the baby is actually the mother. I'm sure most of you must have heard about one film called Baby M. That was when surrogacy started in the UK. And it was a story that was based on a reality. A woman was the one that the egg and sperm of a couple that the woman cannot have a baby was implanted into. It's as if you are borrowing her womb. And she delivered the baby, but after 9 months, she was so attached to the baby that she could not give back the baby to the genetic couple, and it was a lot of issues, and Islam has solved the problem by saying that whoever delivers the baby is the mother. So, what are the facts about IVF? IVF does not give you 100%. That is true. In the best of centers, wherever it is in the whole world, you only have about 50% success. So only 50% of couples will be assisted with IVF. Success rate depends on the age of the woman. The younger the woman, the better her chances. Anybody less than 30, very good chance. 4 out of 10, 5 out of 10 of them, if they're less than 30, they'll get pregnant and they'll have their babies. But if you're above 30, 35, the natural fertility of a woman drops after 35. So anything above that, the chances are really low. What are the myths? That any woman can get pregnant with IVF at any time, even if they are above 50 years of age. The truth is that almost 100% of anybody that got pregnant after 50 used donor eggs. You can quote me anywhere. But they will not tell you. They will tell you, this is a miracle and all that. But we know what happens behind the scenes. It's almost 100% donor eggs that is used. In fact, there are some IVF centers that you go to if you are 38. They will not even tell you, and they will use donor eggs for you, because they don't want their own success rate to be low. So just be very careful whenever you go to any IVF center. And then that you don't need to do IVF more than once. You can do IVF more than once. Some people get it the second time. Some people get it the third time. So IVF can be done more than once. And there's a lot of malpractice in IVF. I assure you of that. The other misconception is that IVF babies are normal. They are very normal. In fact, there may be some sitting here, so if you don't know. They are very normal. They are even very intelligent. And then a woman has unlimited number of eggs. A woman does not have unlimited number of eggs. Unlike the man, that every 60 to 90 days he produces new sperm. The woman, the number of eggs that she was delivered with is what she's going to have throughout her life. In fact, her own undergoes what we call the law of diminishing returns. The egg that she has in her ovaries right from the day she was born, that is the only egg she's ever going to produce. She's not going to produce any again. Every month you have what we call atresia. Many will start growing. Maybe like 10 will start growing. Then only one will be the one to ovulate. All the remaining, what happens to them? They die off. Throughout the reproductive lifestyle of a woman, she only ovulates about 500 eggs. And that is what we call the biological clock of a woman. The number of eggs will finish because of your age. And for the age of menopause, for now, it's about between 45 to 55 years in Nigeria currently. So the number of eggs will diminish. But a man that is 70 years old will still be producing sperms every 60 to 90 days. The only thing is that after the age of 40, the quality of the sperm also reduces, but you can still get children. And that in all cases of fertility, it is the fault of the woman. Because of the fact that it is the woman that takes the pregnancy, they'll be looking at her stomach. Okay, this stomach is not swelling up. So fingers point at her that she's not yet pregnant. But the cause may actually be from the man. The man may be the reason. He may have azoospermia. In fact, during the course of my training, I have a West African certificate of post-fellowship certificate in fertility. So I have a specialty certificate in fertility treatment. During the course of my training, we saw men coming and telling us that, please, they don't want their wives to know that they are the cause. We should get sperm from some other people and inseminate her so that they would have children. In fact, there was a time during the course of my training, the person that was teaching us, he was counseling one sister in hijab that, because you are 50 now, you need to use donor eggs and all that. When the sister went out, I said, sorry, sir. The doctor teaching me was not a Muslim. I said, sorry, sir, in Islam, we don't accept donor eggs. He said, no. In this room here, an imam of a mosque came and we did donor sperm for him and they have children. So I shouldn't tell him that. So I just kept quiet. I said, oh, I don't know. Many people, because of the shame, the infertility for the men, the shame is more if the man knows that it is his fault. The woman is more patient and even maybe allows you to go and marry a second wife and even bears it. But for the man, they don't tolerate it at all. They don't even mind you getting pregnancy somewhere and bringing it to the house just for him to show that he has children. That's what we've also noticed. So it's not always the fault of the woman. It may be equally the fault of the man if there's infertility. How do we cope with infertility? Remember Allah subhanahu wa ta'ala said in Surah Al-Takwir, أعوذ بالله من الشيطان الرجيم وما تشاءون إلا أن يشاء الله رب العالمين. It is what Allah wills that happens. It is not what you will. You cannot will except what Allah wills, the Lord of the worlds. And in Surah Al-Baqarah, ayah 125, Allah also talked about, and it may be that you may like something that is which is good for you. You may dislike something that is good for you, and that you may like something that is bad for you. Allah knows and you do not know. In a hadith by Tirmizi, Rasulullah sallallahu alaihi wasallam was also reported to have said, know that if the whole nation were to gather to benefit you with something, they will not benefit you except what Allah has actually already recorded for you. And that in another hadith in An-Nawawi collection, when Jibril, we all know this hadith, talked to Rasulullah about him informing him what is faith, and he talked about the 6 articles of faith, and in the last one we talked about qadr. Everything that happens to our lives is predestined by Allah subhanahu wa ta'ala. The mothers of the believers, the wives of Rasulullah sallallahu alaihi wasallam, some of them have never been pregnant before. Nana Hafsat radiallahu anha, the bint Umar bin Khattab, was married once before she married Rasulullah sallallahu alaihi wasallam. Same thing, Zainab bint Jahsh radiallahu anha, she was married before. Juwairiya bint Harith, Maymuna bint Harith, Safiya bint Huyay. They were all married previously before they married Rasulullah sallallahu alaihi wasallam. Remember the love that Rasulullah sallallahu alaihi wasallam had for Nana Aisha radiallahu anha. They loved each other so much. He married her as a virgin. He loved her dearly. Her father was his best friend and companion. Revelation even came to him when he was in her room. Don't you think that Nana Aisha, even if it is for her to even have miscarriage, she wanted to have for Rasulullah sallallahu alaihi wasallam, but Allah did not give her that. They were married for 10 years and there was no record of conception between them. Who are the best women in the history of mankind? Asiya, the wife of Fir'aun, Maryam, the daughter of Imran, Fatima, the daughter of Rasulullah sallallahu alaihi wasallam, and Khadija radiallahu anha, the wife of Rasulullah. Asiya, the wife of Fir'aun, was married to one of the greatest monarchs in the history of mankind, but he was a tyrant. She was the queen of her kingdom, and she also had wealth and power, but she had no child. She did not take this as a deficiency, but took in Musa alayhi salam and raised him as her very own son with all the love and care of a mother. She was among the first few people to believe in the message of Musa alayhi salam, and she also showed the true example of what fostering or adoption is in Islam, and her story is mentioned in Surah Al-Tahrim. So what is the summary and the options for a woman with infertility? 1, you can wait for Allah's time, conservative management. Wait, some people say after 15 years, 20 years, Allah gave them pregnancy spontaneously. It is possible. If your iman is that high, you want to wait, there's no problem. You can do the ovulation induction that we mentioned, use of clomiphene, letrozole and others, and you do the timed intercourse. Some people get pregnant with that. Then you can do intrauterine insemination, as we mentioned, it's a step further than the timed intercourse where you prepare the sperm of the husband and put it during the time of ovulation, hoping that the woman will get pregnant. You can do IVF with your own eggs and your husband's sperm, or you can do fostering. Many of us have relatives, your sister's children, your brother's children, a relative, distant relative. You have many orphans that are around. We have many less privileged that we see around. You can pick one of them and then take care of them. It does not mean that you did not deliver, that you cannot be a mother. What about those that deliver and throw them in the streets or throw them in the gutter? But you that takes care of a child from day to day is the person that is defined as a mother. And the other option is to stay without children. What are the things that are not allowed for a Muslim woman? IVF using donor eggs, donor sperm, or donor embryo, because so many embryos, sometimes after the IVF, many embryos still remain. So some people keep it. When you come and there's a problem, they can just use it for you. So you need to have all those knowledge before you go to any IVF center. Adoption as practiced now. Adoption now is not the type that Islam practices. Remember the issue of Zayd, where Rasulullah sallallahu alaihi wasallam was calling him his adopted son, and he was called Zayd bin Muhammad. But a Quranic verse had to come to say that you have to call him with his father's name. So you can adopt, you can foster, but please remember that you have to name that child after the father of that child, not your own name. Then surrogacy, as we mentioned, is not really practiced. There's a lot of emotional turmoil because a woman that has been pregnant and carrying that baby for 9 months, she knows the movement of the child. She feels the connection of the child. Her blood goes through the veins of that child, and then you come and say she should give up that child. In fact, what happens here during the course of my training, for the surrogates, they take them, the couple, we call them commissioning couple, they have the eggs and the embryo from the egg and the sperm, fertilize it, it turns to an embryo, and it is put into the womb of a young person. Usually we use people that are less than 25 years of age. Once the pregnancy is established, they keep the women in a particular place. All the ultrasound scan is given to the commissioning couple. Every news is given to the commissioning couple. On the day of delivery, usually it's done through a cesarean section. Once the cesarean section is done, that woman will not see that baby. The commissioning couple are just waiting by the side. Immediately the baby is brought out, they just give her. So many of them will discover they have a lot of mental health issues. Despite the fact that they pay them 5 million, 6 million, depending on what they pay them at the end of the day. But those women that have taken those babies in the 9 months, they have a lot of psychological problems because you've lost, it's as if a part of you has gone, but that was what you signed for because it was the money they were looking at. But there's a lot of emotional turmoil in that. So Islam has given us the option of don't go into that because any woman that delivers a baby is actually the mother. So don't confuse the lineage of people. Then falsification of pregnancy, crypto pregnancy. It was during my training too that I knew about crypto pregnancy. There are so many scams out there. In fact, in the southern part of the country, it's very common, where you find a woman being given, in fact, there was a sister that went into that, and I told her to come, let me scan her, she refused. They tell you that you are pregnant, they give you a lot of hormones. The hormones they give are actually human menopausal gonadotrophin. They give you those hormones that you not menstruate, and you start putting on weight because it causes a lot of water retention. So they'll tell you, you have pregnancy is special. They'll be giving you the hormones. They'll tell you that you are pregnant. Don't allow anybody to scan you because it's a very special baby. That baby can never be seen on ultrasound. And then, meanwhile, they already have these baby factories somewhere that a woman or a young girl is already pregnant. And they'll tell you your EDD is this date. So they've targeted a young girl for you that is pregnant. And it is the EDD of that woman who will tell you that it's your EDD. They don't let anybody know. Your pregnancy is very special. And then on the day of delivery, they'll come and they'll do a small cut, give you some drugs to make you feel as if you're a bit dizzy, make some small cuts in the vagina and all that, some small blood will come out. And meanwhile, that's what that woman has delivered in the next room. And quickly they'll bring the baby and say, Madam, this is your baby you have delivered. So there's a lot of scam. But many people go for it because of societal pressure. It's not easy. Some people cannot contain the pressure from the society. So then the other thing is that do not blame yourself for your situation because if Allah wanted to give you pregnancy, He would have given you without any problems. So in conclusion now, assisted reproductive technology, as we mentioned, can only assist about 50% of couples. Not everybody with infertility will be solved from IVF. So still, we have about 50% that will not have children. So there will still be some people who will not have children because of the qadr of Allah. And if you are among those who do not have children, accept it and live your life hoping for reward from Allah subhanahu wa ta'ala. And do not ever let the society judge you because you don't have children. And be the best servant of Allah you can be, since one will not enter Jannah by the number of children they have, but rather by your own actions as a servant of Allah subhanahu wa ta'ala. Thank you so much for your attention. And these are my references, and I've already shown you some of the videos. There are others that talk about fertility. أقول قولي هذا أستغفر الله لي ولكم والسلام عليكم ورحمة الله وبركاته.